Welcome to session 8 of the Master Trainer program. And as mentioned earlier, we are going to talk about how do you go about handling aggressive patient party. I'm sure almost all of us must have, seen situations where uh, the patient party or somebody becomes extremely aggressive, and we really are clueless. How do you go about handling that situation? So I just want to ask all of you, how many of you have personally handled aggressive patients or had a situation where you didn't know how to go about handling them? Would anybody like to share their experience? Okay, Dr. Purnima has raised her hand. Anybody else? Aparna, has there been a chance where you have attended any patient who is aggressive? Aparna, your
Uh,
camera is slightly towards up. Yeah, yeah, if you can just,
okay.
yeah.
So it's fine now.
Yeah, it's fine. So have you ever noticed? I'm asking, I know, Raminder, those of us who are senior by now, we all have must have seen situation where the patient party became. I think it's the youngsters who are actually, facing it and also do not have that kind of experience in the background to really rely upon. So that's why I asked Aparna or somebody who is new, but
Uh,
do you handle? So Aparna, would you like to share any
so I
experience?
have, one incident to share.
Mm-hmm.
So I at my hospital I handle quality and MRD as well, medical records department.
Okay.
So many of the patients they they request for the medical records,
Mhm.
the Xerox of copy for the,
Mhm.
medical purposes.
Yeah.
So once what happened is MRD staff was not available.
Mhm.
Since I sit in a different location,
Mhm.
the patient relative he came down. Like
Mhm.
we sit in the basement, so he came to the basement and he started shouting like, मेरा गाड़ी है 7 बजे सुबह का कोई है नहीं nobody is available to give me the papers and I'm very upset and मैं करोड़ों का business चलाता हूँ all that he was just started bursting out and the other people in the admin even they got scared. So I personally what I did, I didn't fret. Like I told him, sir आप please बैठिए 2 मिनट, आपको मैं पानी दूं चाय मंगाऊं, आपको मतलब थोड़ा सा आप शांत हो जाइए, मेरे को आप पूरी बात बताइए कि
Mhm.
असल में क्या हुआ है, किसने आपको कुछ बोला है, कुछ गंदी तरह आपसे बात की है. So he then also he didn't, he was very aggressive. नहीं नहीं मुझे चाहिए, मेरे पेपर्स चाहिए, मुझे कुछ पता नहीं, आप मेरे को कैसे भी लाके दो. So I told कि सर आप मतलब आई एम अ लेडी, प्लीज आप घर में लेडीज से थोड़ा ऐसे जोर जोर से आप बात करते हैं क्या, आई एम अ लेडी ना, तो थोड़ा सा आप लो वॉइस कीजिए, क्योंकि मैं आपसे अच्छी तरह बात कर रही हूँ, तो आप भी मुझसे मतलब मैं एक्सपेक्ट करती हूँ कि आप भी मुझसे अच्छी तरह बात करना.
Mhm.
So then he started little bit, he mellowed down and then he sat
Mhm.
where all the other staff, they we tell them to wait, so he sat and madam, I mean, then he was in a very right tone.
Mhm.
Then he explained me, मैडम मेरे मुझसे ऐसे बिहेवियर किया, मुझे मुझे पेशेंट वेलफेयर ऑफिसर ने ऐसे बोला, मुझे ये गंदी तरह बात की, ऐसे करके सब उनका फ्रस्ट्रेशन बाहर आया. मैंने बोला सर कोई बात नहीं, आपको आपके पेपर्स मैं गारंटी देती हूँ कि कल सुबह 10 बजे तक मिल जाएगा.
Mhm.
सो देन ही सेड ओके, मैं आपको ट्रस्ट करता हूँ और मैं जा रहा हूँ अभी. एंड देन एंड मैम आई मेड श्योर that he got his papers around 8:39 before 10. So he was kind of frustrated with the way the staff spoke to him. So that is why he got frustrated, and then directly he came to the basement, like the people on the floor, they maybe they couldn't handle and they just
Or
sent
maybe
it to me.
to know that
But
he
then
want to come and meet you because he may have asked that whom do I go and connect.
boom,
Okay,
yeah,
thank you,
so
Aparna. I think that was a very interesting incident that you shared. So I want others to comment. What do you think Aparna did right that really worked in her favor? What do you think Aparna did right? Uh, That
She
actually
tried to calm down the agitated patient.
wonderful. So she tried to calm down the agitated patient. Wonderful. What else?
She
Offer
listened to the problem and assured that it will be taken care of, and made a point that it was done before the time.
wonderful. So that means she not only assured, but then she also made sure that whatever she has promised, she delivered that on time. Dr. Purnima has written that she offered him a seat. Yes, I think that was another good thing. Usually, whatever they have experienced earlier, they came with the same notion. So, whatever treatment he must have received at the hand of other staff, he must have come with the same mindset that here also I will have to shout and I'm sure I will not get the right response. But Aparna gave absolutely unexpected response. So that worked in her favor. Great. Anything else? If anybody, yes, Dr. Purnima.
Ma'am, I was just writing in the chat box. She offered him a seat. She gave him a patient listening ear.
Mhm.
Made a promise on which she came through. She
Hmm.
gave him a time and she gave him a deadline in which she will perform, and she made sure she came through. She didn't make an empty promise. She considered what it was. He had said, Raat ko 10 baje gaadi hai, but she said, I'll give it to you tomorrow morning. So
Hmm.
she probably thought about the process involved and she made a promise which she could keep, which reinforced her validity. And
Absolutely.
second thing is that she reminded him of the fact that she was there to help him,
Hmm.
and that she was a lady. Okay, we try not to bring gender into office dealings, but she did that. And she also told that he was at the correct place because she was in a position to address this particular problem. So in
Exactly.
everything, she calmed him down and she came through. That reinforces so that your reputation grows as a person who's able to resolve conflict. Thank you.
Absolutely. I think that's so good. I could thank you. That was a good point. Anything else that Dr. Purnima has, I mean, anything you want to add to what Dr. Purnima has said?
Nothing. She covered almost all aspects, I think, ma'am. And I
And
just want to add that she intelligently used the gender card as well. I just want to say that.
that's okay. I think whatever works should be used at
Yes,
that point. There's
that's
nothing.
improvisation, I will say.
And it also sometimes works as a reminder. I mean, she must have come in. If you remember, I shared that case where my staff was misbehaved by one of the attendants. So that's why I said you can't treat people just because you are well off or you are educated. You are supposed to be respectful. But she could touch that chord. I think one more point that I observed was that even if he was aggressive, she kept asserting. So if you keep asserting, the other person automatically will start mirroring your behavior. I think that was one learning I had from her. This thing. Had she become agitated, had she also reacted in the same manner, probably things would have, got escalated. But she made sure that she did not, shout or did not reply in a confrontational manner. Thank you, Aparna. I think your incident. We have been
Thank
good
you, ma'am.
discussion.
I just want to add one more point. Like, when he just barged in the admin, the
Mm,
patient,
mm,
other staff got scared, so that made me more like,
mm.
no, I need to take a step ahead and I need to handle the situation, because the
Great.
other staff was like, they were looking at me. So I was like, so I was like, I
So
had to step
taking
in and I
charge
had
is
to.
also very important. See, taking charge is also very important. If you can sense something and if you are not responding, if you are not taking responsibility, if you are not talking to that person in a responsible manner, again, it is bound to escalate. It's bound to deteriorate. So you sense the sensitivity of the situation and you came forward and you decided to communicate. Had you also got scared, probably things would have been very different from what you narrated. Thank you. Would anybody like to share their experience, like Aparna, if something you have been able to, successfully, or if you were not able to manage, even that can be a good learning for all of us. You could share even an incident where you didn't know how to handle and you were really very upset or scared, or maybe you also got aggressive or anything. There's nothing wrong if you share even that kind of experience. Dr. Vijay, I think you said you also have seen situations where you
No,
handle.
sir. I'm just thinking which incident I want to narrate, because working in a government scenario, especially in Kerala, where people are more aware of their rights than their responsibilities.
Yeah.
So these kind of issues happens on a daily basis. So
So at the end, could you, I mean, if you are doing it every day, so I'm sure you must be really pro at it by now. And at the end of the such interactions, are you satisfied and are your patients satisfied?
I mean, it's a mixed bag of feelings, because many of the times, so they will be coming with all sort of kind of unpractical demands and allegations, uh, and as a government hospital, we have a lot of shortcomings. So we will be coming in between. We'll be submerged in between these two scenarios together. So sometimes we will be, because last day the problem which I faced was that our ramp, patient moving ramp, was having some it's a 25-year-old building. Hospital is in a seaside, so the rusting and this destruction pace is going so fast. So ramp, some ceiling was getting a bit erratic, and it's started falling down. So patient just passed by, ceiling just fell just behind him. So it was a lucky escape for all. So the whole family, along with the whole village, came to ask this. So we have nothing to answer other than some tips which you give. And unfortunately, I don't have enough seats to accommodate them all. So, so kind of, I just asked them, 2 or 3 people, you come, let's sit, let's talk. So those kind of thing, and very, very calmly, very politely. And I did some kind of blame, give back to the government. You know our system. We are trying our level best to help you all. This is not in our control. Anyway, I was trying my level best not to threaten them more, or not to get them more enraged. So likewise, I was just dealing them. Ultimately, they said we will go and complain to the MLA minister, and they just left. They just want to give some mouthful to the authorities or to the person who was there available at that moment. And unfortunately, I was there at that particular moment. So I just tried to be the cushion so that this thing won't get escalated further. So it just went like that. That was the last week, another incident. That was that one.
Sure. So I want to ask everyone a question about what are the common reasons for people becoming aggressive? You can write in the chat box. What are the usual reasons that you have seen people getting, aggressive? Not happy with the outcome. Agree. That's a very common reason they will be annoyed. Not meeting the expectation. Yeah, if they're having some expectation and it is not well met, they're annoyed. So anger, yes, Dr. Som, I agree, because that's internal reason. If maybe there are people who are personality-wise more aggressive, and they would react to everything. Lack of complete information and long waiting hours. Yes, these are again common reasons. When condition of the patient becomes worse, that means it deteriorates, definitely they are unhappy with the outcome, so they will be frustration and anger about outcome. Yes, gap between expectation and perception. Correct. Not feeling welcome. Yes, when they are not attended promptly, so they can discharge and billing issues. Yeah, these are also very common reasons. Lack of resources. Absolutely. Poor quality of care when they're not happy with the quality of care. Yes. Restricted visiting hours and delay in management of symptoms. Yeah, that can be another reason why they can become upset. Ignorance about the process. Yeah, when they don't know the process and they have some expectation, if it's a mismatch, that definitely. And not able to satisfy the patient, especially if we are not able to satisfy the patient and the family. An indifferent attitude towards patients by healthcare. Absolutely right. I think that's another common reason. They'll have a pent up anger, and then it might come out at a right or wrong place of situation. Then suffering they are going through. Yes, that's Aparna, another point I think you have brought in. A lot of time, their own disease is so painful and overwhelming that they would be very easily, can be triggered. Yeah. Delay in discharge, communication gap, yes. And then not getting proper response of their queries. Yeah. So when they don't get proper information or they're not satisfied with the answer, yes, there is a possibility that they can become initially they'll be upset and then they can become aggressive with the because as the time passes and if their situation is not addressed, they can become they can lose their composure. Absolutely. So do we have any system to handle particularly aggressive patients? Suppose if there's a violence, I'm not talking about the mob attack. Of course, mob attack is a different thing. But for example, one patient party becomes aggressive. Do we have a protocol in the hospitals? Code violate, yeah. But code violate, okay. So if I say code violate, normally how do we respond to code violate? If you have anybody has recently witnessed, what all do you do? What all do you do? Anybody would like to?
So, Dr. Indu, in my hospital, we have this code purple.
Hmm.
So where whenever a patient gets aggressive, whenever he's trying to kind of physically harm the staff or whatever the aggressive situation. So the code is announced definitely, and the patient welfare team comes in
Hmm.
along with the security. So we have a separate counseling room,
Hmm.
near our front office section where the security manager he takes the patient or the relative, whoever it is, they make them understand like आपका क्या problem है, what is your problem, and mostly there are financial issues. So they call in the financial counselor, all the people who are involved along with the patient welfare, and they try to calm the situation down.
Hmm.
And once that is done, then either the patient walks away or patient relative walks away, or they kind of give in. So, and then after that, the code gets deactivated, and then a proper incident report with proper analysis and all that gets submitted to the quality department.
So is
And
it
then if the quality
the
team is
security
available at
officer?
that time, sorry, security manager, yeah, whenever he's available during the day hours, definitely the security manager is always there. And if not, if some night hours, then we have a night supervisor. So she is there along with the security guards. So they deal with the situation. And if there is a female aggressive patient, then definitely a female security and male.
So how much bringing in the security officer in this situation right in the beginning really help? I want to ask others if they want to share their experience. Yes, there's a patient who is maybe becoming aggressive, shouting, or maybe arguing in loud voice. In that particular situation, bringing in the security officer or security manager directly, how far is it helpful to control or mitigate the situation?
Ma'am, usually it is the immediate in charge and we have a patient counselor who goes and manages. But in case it is that you feel that it is a threat to the staff,
Mm.
then
Mm.
definitely security officer is the one who will be able to handle the situation better.
Sure, sure. So you all have action plan, to handle such situation. We have code violate, code purple, like you're saying. But how many of us or our staff members, because we probably come much later in picture, how many of our staff members are confident to handle this situation in a very confident manner? And how many of you are confident of your staff being able to manage such patients? Are you? Are you confident of your staff?
No, and if I would say that definitely, because we don't, when suppose if I am attending the code purple,
Hmm.
and so I need to understand the situation, what exactly happened. So it is
Yeah.
very difficult to to think and कि अब क्या करना चाहिए, how to
पर अगर
Go
उसको सोचना है, so Aparna, that means if we have to think at that time, what do we do? That means the steps have to be very, very clear to everybody. The whole idea is it is not just the seniors who should know how to handle it. Anybody who is a frontliner will have to know what are the steps I am supposed to follow, what is the protocol, what are the guidelines that I am supposed to follow. So, Dr. Razak, in your country, do you have some protocols in place which are followed, which are well spread to the frontliners?
Actually, I am not aware of any protocol, but in my hospital, usually I have some people like they are called supervisor of the hospitals. Actually, whenever any situation are taking place, they come first, and if they can't manage, as early as possible, they inform me as a deputy director of the hospital, and then I have to go to the hospital and make my security not in front of the patient party, but they actually alert about the situation. And of course, obviously, my local thana, I have a good communication with my local leaders, community leaders, and also my local police station. If the situation is out of my control, then I have to call the local leaders to help. This is your property. Actually, we have a good relation with my local leaders, and they come to the hospital, and actually they are well known to the patient party. Whenever they came in the space, they came not with to help me. They actually came to the scenario to help the patient. Then actually,
So
in my
kind of,
office,
on your behalf, they
yes.
go and talk to them.
Yeah.
So I think, of course, having good terms with community and local police is very important. It's helpful also. Absolutely, that you never know what might be required at what point of time. But in the hospital, I think every staff member should know how do we go about mitigating that situation.
Actually, in my hospital, supervisor and nursing in charge, every nursing in charge in a ward. Actually, we like to train them how to communicate with the aggressive people and how to take control and how to inform all of the staff and like a security to their seniors. They are actually well known about the situation.
Sure. Thank you. So I think today's session, first of all, it will give us a broader picture, because we normally look at the aggressive patient party as troublemaker. So we believe this person is a troublemaker, and we have to control the situation and we have to minimize the damage and then somehow, finish it off. That's the idea. So I hope today's session will open our mind to the idea that why do people become angry? Can we do something to reduce the number of triggers that can make people angry? And then of course, how do we handle that in a manner, and where to draw a line, where we are going to talk, where we are not going to talk, and what all we should do when we are interacting with the patient party. I think this session will give us little deeper insight of the situation, and also preparing us better for handling such situation. Of course, each one of us have to handle the situation as it comes. So you will have to, manage it yourself. But this background will definitely help you get better prepared for it. So I would normally say that, like we have learned medical triaging, where we identify patients who are critically ill and they should be attended first. I have coined a term called social triaging. So social triaging, identifying situations and patients or their family members who are more prone to become aggressive. So that's something we have to learn to handle, learn to first of all identify and then handle. So I was talking to my daughter who is a dentist, who's practicing in US. So I said, how do you handle aggressive patient party? I was just talking to her and I just asked her. She said, we do a disc analysis. So I said disc analysis is a very elaborate personality test. If someone has an idea, it's more like, MBTI. It's like a personality test for the for anybody. So I said disc analysis is a very elaborate test. How do you do that? Because once patient comes in, you don't have time to give a questionnaire that, okay, you take this questionnaire and I will do analysis for you. She said no. The especially the person, usually it is the front desk staff to start with, and of course the other staff also have learned disc analysis. They don't give any questionnaire to the patient, but they observe and they talk to the patient, and the replies the patient gives, or the overall demeanor of the patient, they get an idea that this patient is likely to be either anxious or more aggressive, or some other kind of personality traits they are able to identify. And she said we write on the top of the case sheet on the left or the right corner, in coded language, that this is the personality type of the patient. So when this patient goes to the next person and then to the next person, they're able to see and also, get an idea that, okay, we have to handle this patient carefully. So similarly, I think we really need to know what situations, in what situations patient is more likely to become aggressive or lose their composure. So can you identify some situations where you think the patient is likely to become aggressive? Write in the chat box. Jenna, your camera is not on. Is there some challenge on your side? Because if you're not visible, then, oh yes, Jenna, I remember you mentioned that you will not be able to have your camera on. Thank you for reminding. Yeah. So Anu, I can't see you, and some more people. Yeah, keep your camera on. Otherwise, they'll forget that you're with me. So for Mr. Vijayaraj, I understand, but rest of you who can have your camera on, please make sure that you're visible. So what do you say? What are the situations or conditions when this the patient party is more likely to? Of course, you have mentioned in the causes, but yes, when the patient's condition is critical, absolutely, they are more likely to. Family is more likely to become aggressive. Absolutely. Anything else that you think where the possibility of aggressive reaction becomes? Okay, when the patient is unattended, okay. When there is interpersonal issue, okay. When with attendants, okay. When estimate is not given properly, so financial dispute, like you said, not getting the reply on time, okay. So what medical conditions can precipitate aggressive reaction from the patient? Where the patient can become either aggressive or even violent. Okay, fear of death, yes, definitely. When there's a fear of death, the patient family can react. Sleep deprivation, yes. Emotional exhaustion, yes. Patient with psychiatric condition, absolutely. I mean, schizophrenic, even maniacs, even they can become very aggressive. Hunger, yes. Hunger, if you're tired, if you're sleep deprived, yes. Yeah. So doctor not updating, yeah. Information loss. So yes, some medicines also can precipitate it. ICU psychosis, Raminder, I completely agree with you. That's very common. And of course, most of the people know that ICU psychosis is possible, but honestly, not many of us know how to handle it or how to respond to it. And I've personally experienced this, so I can, speak on my personal experience behalf. My father, who underwent bypass surgery, everything was fine. And I went out of Delhi for a day. I thought I'll come back next day, and in between he had hospital ICU psychosis. They gave medication. They put him on antipsychotic immediately, but then they didn't know how to handle the situation. They were actually aggravating the situation by not handling it in a professional manner. And I personally experienced this. Yeah. So of course, certain medical conditions like dementia, delirium, traumatic injury, or other neurological condition, I'm sure you all must have witnessed patients becoming aggressive. If you remember that case, what was that girl's name? Dr. Vinita in Kerala, very young doctor who got stabbed by patient who was alcoholic?
Ma'am, Dr. Vandana.
Vandana. Yeah, Vandana. I'm sorry, I thought Vinita. It's Vandana. So, I mean, I wish we were vigilant. I wish we could think that if this patient is, is drunk, there's all possibility of this patient becoming uh, aggressive and being violent. And unfortunately, she was all alone. There was nobody to protect her or to safeguard her. So there are, and substance use and withdrawal both can cause, patient becoming violent. Severe pain, severe pain again can cause patient becoming agitated. So, what environmental factors do you think can make patient party become agitated? Especially overcrowding, noise, room not ventilated. I think noise, overcrowding, heat can these all can aggravate the situation. So the idea is if we know that these situations can easily precipitate agitative behavior, then we need to be in the know of it and also try to see how we can handle it. So I normally say it never starts raining all of a sudden. There's always a storm before it rains. So there are signs, there are clear indications, and if you can identify them, and for that we need to train our staff, nurses, residents, security staff, frontliners, I mean, especially on the front desk staff, technicians, everybody, I think they should be in the know of these warning signs. And if they're able to identify these signs and then attend them promptly, I think we will be able to control a lot of situations where we experience violence or aggressive reaction coming from the patient. So I came across a very interesting article by, Mark Gorkin. I was trying to read why do people become angry and why do people become aggressive. So although we never endorse aggression, it is not acceptable. But understanding the underlying cause, why patient or patient party can become angry and aggressive, and if we can, manage some of those factors, I think we will be able to prevent some violence and aggressive reaction coming from the patient party. So let me share the screen with you and talk about what Mark Gorkin says that what causes aggressive reaction. Give me 1 second to share this screen. So we have talked about why people become aggressive, but this is little bit, going deeper in the patient psyche. And as I said, that this article really, made me curious to understand why do we become angry. So Mark Hawkins says that anger starts with four I. Whenever one has a palpable sense of injustice, injury, invasion, and intention, there's a possibility of aggressive reaction. So the first I is injustice. So whenever you will see any patient or attendant, when they see themselves as a victim of, any injustice or unfair or disloyal treatment, they will always feel that they have not, received a fair treatment. So studies show actually that patients, when they are looked after by us or when they're treated by us, a lot of them actually experience that they have received unfair treatment. And I'm sure you will agree with it. This study, for example, says that 20% of the patients reported experiencing some form of unfair treatment. Another study have shown that in 26% of the patients reported injustice, such as receiving inadequate or disrespectful treatment. Another study showed almost like 30% of the patients reported experiencing some form of mistreatment, such as verbal abuse or neglect by the healthcare worker. The second I is injury. So whenever patient or their family member feel that they have received some kind of harm at our hands, they feel that we haven't been responsible. Whenever they also feel being disrespected, discarded, or ignored, there is a sense of insult and humiliation along with injury. So if you see a couple of these pictures that I'm sharing with you, I'm sure in OT, ICU, labor room, we see patients inappropriately covered. Their gowns are either torn or they are not buttoned properly, or they are big or small for them. And this picture where the patient is lying as a specimen in front of so many people. So these experiences do add to their insult and humiliation. A lot of time when we handle the patient little rough, hold their hands tight, although the intention is not to harm them, but they feel that they have been disrespected. There's a feeling that we have harmed the patient. This study, studied almost like 32,000 patients, and it said that patients experienced fall. I think that's very common. I'm sure you will agree with me on that. Pressure ulcers are again very common, medication error and surgical complications. So these are all different kind of injuries the patient experienced at our hand. In another study, almost 40% of the patients reported that they experienced, some adverse event, and almost 18% of the patient experienced psychological harm such as anxiety, depression as a result of the adverse event. And we all know, even the WHO has shown that we all patients experience a lot of injury and harm at our hand. Almost 1 in 10 patients experience harm while receiving hospital care. 10 out of 100 patients acquire infection from the hospital, infection that they had not come with. Half of the harm is attributed to medication. Approximately 12.7% adverse event happens for every 100 hospitalization. And then 3 to 5 patients per 1,000 bed days experience patient fall. And then 5.7 to 8.4 million deaths due to suboptimal quality care. And more than 50% of the harm is preventable. So I think this gives us a global picture, how much of harm we are doing to the patient. A lot of time they don't get to know, but a lot of time they get to notice and realize that we have done more harm than anything. The third I is invasion. So patients, when they are in hospital, they feel that their personal space is constricted, disrupted, or violated. And we all know we enter patient's room without any signposting, sometimes even without knocking. And a lot of times the patient is right in the place where there are 3 patients in a room or 4 patients in a room, and we start examining the patient or doing a procedure or even asking certain questions without realizing that there are people who are overhearing the discussion. And we think it's okay. The patient is here for treatment, so it's okay. So even when their identity, whether bodily or psychological integrity is threatened, it's more like an invasion. So having a cameras also, around them makes them feel that they are always under us. And you must have seen even during rounds, a lot of doctors and nurses, they're together and the patient case is discussed. We assume that it's all right or it's okay. But for patient, it becomes sometimes very uncomfortable to accept that their case is being discussed openly in front of everyone. And there are other patients and their attendants who are also overhearing that discussion. So another study where the patients were asked about their experience about privacy and dignity during childbirth, a lot of patients actually reported feeling violated. And we all know that in labor room, I have personally witnessed one case. My nephew's wife was she went for her surgery. That was yeah, she for childbirth. I mean, after the surgery, she was almost half uncovered, not even properly, draped. They were everybody, nurses, doctors, technicians, everybody was moving around. So they do feel that their privacy during childbirth is not really attended with great respect. Even in psychiatric consultations, patients feel that either they have been discriminated or stigmatized because of their condition. And also, when it came to talking about their health condition, they felt lack of privacy and confidentiality during the consultation. So these are things probably we don't even realize that they would be seen as invasion by the patient party, but all this adds to anger. So whenever there is an injury, there's an insult, there's an invasion, intention to address or challenge something like this is bound to happen. So there's a possibility of acting out when the patient has that energy and determination to do something and also challenge the status. A lot of time we think this is something very normal, there's nothing to think about, but a lot of time at the same time, the patient party might not take that insult and might become aggressive. So these are all reasons which can be, managed, mitigated, prevented. Just proactive, responsible, professional conduct can help us at least look after their injury or their injustice or invasion that they experience. So, talking about the aggressive patient party, as I said, nothing happens all of a sudden. So, these are crisis development. You will see there will be beginning, there will be some kind of changes that you will be able to notice before the patient party actually becomes aggressive. Now, for example, Aparna talked about her experience when the patient came in a very aggressive way and started fighting with her. So initially he did go to one person, then maybe to the second one, then maybe the third one, and then he decided to go and meet Aparna. So that means if somebody at stage 1, stage 2, stage 3 had handled it, probably he wouldn't have come and shouted at her or would have become aggressive. So this crisis development and management stages will help us where all we can actually intervene and control the situation and mitigate. Because there will be a point where we will not be able to do much other than just ensuring our safety. I'm not even sure how many of us are really able to ensure our safety even at that stage. So stage 1 is stage of anxiety. And this is more or less something that we discussed in the previous class, that is managing and addressing their complaints or their requests. So this is stage 1, and the management also will be more or less same. So most of the things you will find very similar to what we discussed in the last class. So stage 1 is when they're upset about something and they want their concern to be addressed, somebody to listen to them. So you will see an observable and unusual change or increase in behavior. So what do you normally see in this situation when they're in stage 1, when they're in anxiety stage? So what kind of changes do you think you will notice in their behavior? Write in the chat box. Yes, they look anxious. Absolutely. You can make out from their body language. Frequently calling the staff or ringing bell. Okay. Restlessness, more phone conversation, fidgeting. Yes, agreed. How about their way of talking to the hospital staff? Yes, high pitch. You will see high pitch, showing off their political context. Very often, yes, if they have some access to, their political contacts, definitely they will try to call their name and then make them call and ask them to come in or call on their behalf. Absolutely. What else? Shouting at the staff nurses. Yes, especially when they can see that this is the person who cannot harm me in any way, there's a possibility that they will shout at people. Absolutely. Fault finding. Yes, that's also very common. So they will try to make you feel that you're not doing enough or you're not good enough. So initially, when they will be, you know, upset or they will want their concern to be addressed, you will see that they're, first of all, they'll speak at a louder voice. So they want to indicate that they are angry. You will see them pacing up and down. They'll also try to talk to different people. They'll ask a number of questions because they are not satisfied with the reply they are receiving. They will also express doubt on the information that they are receiving. So they'll try to talk to you, they'll try to talk to your staff, they will try to talk outside, they will also talk to their own family member. So that clearly shows that they are upset and they want their concern to be addressed. So if you remember, this is what we had discussed in the previous class, where I think the moment we identify this, rather than ignoring this, we need to pay attention and then attend to them. One good way is if you segregate them from the crowd and ask them to sit down and tell their concern. So they will get a chance to express in a more verbal manner, more cordial manner to you what exactly is the situation or what they are wanting or what they are upset about. So again, it's very important to communicate and follow the process where you identify who you are, what is your role, how you can help, what is the procedure that you're going to follow. Of course, when you see them upset, unhappy, angry, acknowledging is the way to tell that yes, you can sense that they are very upset. Empathizing that I can understand, you must be really disturbed. Of course, at the same time, if you have an idea what kind of questions they are going to put to you, and if you know how to handle them, a lot of time even that can help control the situation. Try to identify the reason why they are upset. So not only ask questions, observe them, observe their body language, and also listen to understand. At this stage, I think if you are able to listen to their concern with great attention, half of their suffering will go down. So, like Aparna said, that she made him sit and then she said, tell me what is your problem and let me understand and help you. Most of the situation can be looked after at this stage. So, when they are explaining, not only listen to what they are saying, but also understand the feelings behind the fact. And also, if you need to ask questions to clarify, don't hesitate asking questions after they are finished, because that's where you will get the clarity on what is their concern. We have discussed this last time, so I'm not spending much time on it. So when they're sharing their concern, please make sure that you look after your demeanor, because a lot of time our body language is very, conflicting to them, or it is indicating that you are not agreeing with them. So interrupting at this point is not helpful. Correcting them at this point is not helpful. And we should not be in a hurry to justify ourselves. Also, even if their concern is very small according to you, please don't shun away that concern because it's upsetting to them. So at this stage, rather than shunning away their concern or correcting them or interrupting them, it's better to just understand what is bothering them. So at this stage, empathy will help us in understanding what is their concern. Instead of judging or discounting their feelings, please remember those feelings are real to them. They may appear very, very small, but acknowledging them and accepting them is what will help you here. So acknowledge what they are expressing, normalize and generalize. So that will give them a feeling that yes, you are able to not only understand what they are experiencing, but you're also validating their feelings. So at this stage, apologizing is something that can help again, you can calm down. So again, apology is not for the mistake, unless there is a mistake. It could be also for the inconvenience. We have discussed this last time, if you remember. I hope you remember this, yeah. So I'm not spending much time on it, but we move to stage 2 and then the further discussion will hold. So in case if nothing wrong has been done by any one of us, so I mean, it's more of a expression of compassion for what the patient is experiencing. But in case there has been some harm because of our mishandling, for example, injury or some infection, of course, we have to take responsibility. And I mean, if they're challenging that. So a lot of time when we apologize in this manner, it doesn't help. When you say what you're saying is true, but then that's how we have to control the patient. If the patient is violent, we have to hold their hands tight and we have to tie their hands. And sometimes when we tie their hands, there can be, skin can get abrased or there can be to harm to the patient. But such apologies will not help in that situation. So whatever they are looking for, try to explore what exactly they want. At this stage, if you think what they are looking for and if you are able to provide, you will be able to resolve the conflict here. So sincerely try to resolve the issue and address their concern. And again, focus on the solution rather than on the behavior. A lot of times their behavior may not be appropriate, but you have to remember, we have to keep the patient's welfare in mind. So at this moment, avoid being defensive and being argumentative. If we are not able to handle this situation and control it here, there's a possibility there will be crisis stage 2. Crisis stage 2 is called defensive state. So what do you think if the patient party is not satisfied? What happens in this state? When they become defensive, what further changes do you see in them? Write in the chat box, please. Suppose if we are not able to handle this situation amicably, they are not satisfied with the solution, they are not satisfied with the outcome. So, and it escalates. So what changes do you think you will see in their behavior? Okay, they may want to go lama. Okay, that's one of the possibilities. They will decide to go. Or they will avoid talking. Okay. Then make statements justifying their response. Okay, that's also one of the possibilities. They'll compare with other hospitals. Yes, very often now they want to put you down. So they'll become more aggressive. They will also, express dissatisfaction in your care. They try to gather an audience. Yes, that's also because now they want to kind of shame us, or they want to humiliate us, or they want to show us that they are not really, really happy. Okay. That's okay, yeah. So they will give negative feedback on social platform. Yeah, that's also one of the possible. Yeah. So they may threaten to call media. Yes, these are all possibilities that they will not only start shouting at a louder voice. Earlier they were less loud, but now they will speak in a loud voice because what they want is they want to, call people. So changes you will see that there will be increased emotionality. You will see now they are actually losing rationality. They are not understanding, like for example, for poor outcome, instead of focusing on the comorbidities or the state in which the patient came in, they will argue about the care that you provided. And they may want to blame you for poor care or poor attention or poor management. So there will be increased emotionality, they will lose rationality, they will speak at a louder voice, even their body language will become aggressive. You can make out from their body language that they are like Aparna said that he was shouting And also from his body language, we could sense that he's very angry. So everybody got scared. That's what she said. So they may also, start challenging you or your authority or your hospital, and they will become belligerent. So they will talk things that are not even related with this situation. So at this situation, you will see that their voice would become louder, because, as you said, that they would want others to listen to what they are saying. So earlier it was one on one. Now they want to gather audience. So not only they will speak at a louder voice, but they'll start arguing with your security staff, technicians, nursing staff, because these are the people with whom they can show their anger and anger and aggression. There will be an expression of dissatisfaction about the services, about the care, about the management, about even hearing. Then there will also be an expression of disagreement. Whatever you will offer or kind of discuss, they will not agree to it. They may completely refuse to listen to what we are saying. They can also refuse to cooperate. For example, you say, okay, you kindly wait, I will get this done. No, 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 I want it immediately. Or you ask them, okay, you make the payment and then we will do. No, you first do the test, we will do the payment later. So they will refuse to cooperate. They may even refuse to pay. In this situation, our response has to be providing guidance. So, because as they are losing rationality, you will have to stay calm and also provide guidance. How are they expected to behave? So, asking them to calm down and then express properly and also listen to you will will help them to understand your point of view. But then at that moment, you need to have good control of your own anger and aggression. A lot of time with this behavior, even we become agitated and we start reacting in the same manner. So if they are not satisfied with you, maybe you can ask them that, okay, we have our patient relation officer. You can go and speak to our patient relation officer. You can write a complaint and give it to our, administrator, or you can give feedback to or speak to the person who can really, really help them. So basically, you have to help them understand that rather than getting angry, they must take the right step to communicate their concern or to address their concern. At this stage, it's very important to remember that we need to have a problem solving approach. And if we become aggressive, if we become angry, chances are that we will be aggravating this situation. So take control of the escalating situation, but with the problem solving attitude or approach. Also, at this stage, assertion will be of great help. So, if you are able to communicate to them what you can do and what they should do. For example, if they are shouting and they are not ready to listen to you, but you assert and you say, I want to help you, but if this is the way you are shouting at me or my staff, we will not be able to help you. So, you'll have to really set boundaries and help them, see that aggressive behavior is unacceptable and that's not going to get them what they want. So at this stage, being firm but non-aggressive will be of great help. So even, how many of you have done that questionnaire that I sent in the group on conflict resolution style? All of you have done? Okay, most of you have done. Great. So did you get to notice your uh, conflict resolution style? All of you? So would you be okay if I asked you to write in the chat box about your first and second conflict management style? Write your first and second conflict management style. So I can see 4 responses waiting for others to. add their Dr. Purnima, which is your second one? Okay, you have two in second.
Yes,
Accommodate.
ma'am.
Okay.
Accommodating and compromising both.
Okay. So have all of you finished writing or some of you are still writing? Yeah, Anandita has written collaborative and then avoidant turtle. Okay. And accommodating teddy bear. Okay.
Both got the same marks, ma'am.
Yeah. So what do you understand from these four styles? What is avoidant?
Who tries to avoid the situation and shies away?
So that means if you remember our even communication style, so you would not want to take a stand. So see, in this conflict management style, there are two primary factors. One is your assertiveness, ability to communicate. And second is your cooperativeness, how cooperative you are. These are the two primary dimensions on which your conflict resolution style depends. So when you are avoidant, that means you are not asserting. You are avoiding to communicate what you're feeling or what you want or what you think. And when it comes to accommodating, so in accommodating, again, you are asserting, but you are valuing relationship more than the task. So you are okay to accommodate other person's needs. So you are cooperative. So when you are collaborating, both communication and also cooperation are on the high list. So the most desirable is collaborating. But in a lot of situations, this does not work. For example, the other person is avoidant. You will have challenge. Other person is, is competitive. Your collaborative will not work. Knowing your conflict resolution style is of great help because it will let you know how you handle situations, especially difficult situations or conflicting situations. So why I asked you to put first two, because one is your primary way of handling. The second one is your backup one. If the first one does not work, which is the second one you will pick up. So for example, Dr. Razak, in your case, uh, accommodating teddy bear and competitive shark both have got the same mark. So again, you may be using both of them. But what about the second one? Please check it. Do you agree with your score? Dr. Razak, you're answering?
Yes, collaborative. Second one is collaborative.
Second one is collaborative.
A competitive shark and accommodative teddy bear bears the 6, and the second one is collaborative.
And what is the score?
7.
Okay.
6 and 7. First two is 6. Second one is 7.
Okay. So do you all agree with your scores? And do you agree with your conflict resolution style? You get clarity on it. So, but please remember, of course, collaborative is the most desirable one. Accommodating is also okay because we want to create a win-win kind of a situation. In compromising style, you are letting go some of your wishes or desires or rights. But again, you are valuing the relationship or the task, which is important, and you are okay to compromise. But then But if you are compromising and the other person is competing, again, it's not going to be a very healthy kind of a relationship. So all will depend on what is your way of handling conflict. If your conflict resolution style is collaborative, you will try to find a situation where the patient goes happy and your rights are also looked after. Similarly, if you are into a competitive style of conflict resolution, you will always try to see how I can win over this situation. And you will not care for what the other party is going to experience out of it. So when we are handling stage 2, that is when the patient has become defensive, problem solving approach is what's going to help us. So here we need to assert, but also at the same time, we need to keep the patient's interest in mind and see how that can be helped. Now, when the patient party becomes aggressive and is in defensive state, there are a couple of points that we have to keep in mind that will help you to handle the situation and mitigate it. One point that's very important here is please be aware of your body position. A lot of time, so when I say you, it doesn't mean only you, it could be your security staff. Somebody going and standing very close to the patient party or standing eye to eye or toe to toe is going to actually agitate and also make the patient party anxious. So it's not a good idea to stand very close to the patient, neither you nor any one of your staff member. Because also invading their personal space will give them, can trigger anxiety and they may act out of fear to protect themselves. So good idea is to at least have kind of a 3 feet distance between you and the patient party. I would recommend we should have a table in between the healthcare provider and the patient party. I also recommend 2-door policy in the counseling room. Because if you have observed, if you are sitting on a table and the other side is the patient party, usually the door will be behind the patient party. If you are feeling unsafe and if you can sense the patient party can become, aggressive and become violent, even if you will try to go out for your safety reasons, you will have to cross the table, cross them, and then go out. All the more possibility that the patient or patient family members can catch hold of you. So it's always a good idea to have one door behind you. Because if you feel unsafe, you should be able to protect yourself and move, giving some reason. I'm going to call my senior or let me go and check and find out. And then, you can go out of that room without crossing them. So I would recommend a 2-door policy. The third point is it's always, helpful not to argue. A lot of time they will keep saying something, blaming you, finding fault, talk about other patients, talk about other issues. There's no point you answering every statement because a lot of time they just want to trigger you, to provoke you. So some of the challenging questions can actually be ignored without actually asking them. It's helpful to redirect their attention, to the issue at hand, and especially the patient's welfare. So rather than, answering their questions, it's better to bring their attention to what is going to help the patient. If you allow them to speak and if you listen to them, it also helps in letting them vent. So if you are able to, if you are okay, if you are safe, and if you can allow them to, talk about the problem, venting helps. And if you can't allow that, something like this, for example, if it is in the labor room or in the ICU or it's at the bedside, so there you will have to actually, give directions and tell that we can't be, shouting in the labor room or in the ICU. And let's go and sit and talk in the counseling or at a place wherever you think they can be allowed to speak about their problem. So it's important to set and enforce reasonable limit. For example, you need to offer them choices, what all they can do, and the consequences. For example, in the first one also we said we can tell them, see, if you are not satisfied, you can speak to the doctor in charge. If you want, you can speak, you can write a feedback. If you want, you can write a complaint. So you are giving them what all they can do. That way they will get an idea what options they have for them. Especially when they are becoming belligerent, they are defensive, you will have to really state limits. There you'll have to tell them, see, we can't allow you to shout like this. There are other patients in the ICU. It's not okay to shout at this high pitch voice. So when you are setting limits or also telling them of the consequences, please do not promise any consequence that you cannot deliver. So a lot of time, if out of anger you say, if you don't listen to me, I'm going to, I'll get you trashed by my security staff. I know we don't do this, but I'm just giving an example. So such kind of consequences should never be, made as a comment. In this situation, it's very important to keep your non-verbals non-threatening. Because especially when the person is angry, they are not listening to your words, but they are definitely observing your body language and your non-verbal. So if your non-verbals are, non-aggressive, then it is not fueling their anger. We really need to be mindful of our own body language, facial expression, tone of voice, because if we are able to keep that normal or professional, chances are that at least that aggressive reaction would come out. Then some expressions that can aggravate this situation, for example, when you say, I don't care, or I can't do anything, or what can I do? That's not my job. Definitely at this stage, if you have that kind of an expression on your face or in your body language, that's going to further aggravate the situation. It's very important to remember that we don't have to overreact to this situation. Patient is angry, but please remember, the only one person you can control is you. So if you can control yourself, you can remain calm, rational, and professional. In a while, you will see that will also have a calming effect on the other party. Because your response has a direct effect on the person's behavior. So use assertion, use your tone of voice, which should be firm but should not be threatening. Certain actions like tit for tat are not advisable at this situation, because then that's going to further aggravate. Something like shouting at the patient, or speaking at the same loud voice, or banging door, or throwing their file of papers. Go away from here. I'm not going to listen to you. Don't talk to me. Go and complain to anybody you want. So all these things are not going to help. So even calling security without any provocation is also not a good idea. So having security ready to control the situation in case the patient party becomes angry or violent is perfectly all right. But they should not be in the visual field of the patient party, because that itself can trigger the patient party and they can over. So in this situation, it's very important to keep a check on how you're feeling in this situation. So if you think that you are feeling overwhelmed, I think it's important to, let someone else handle it, especially if you have somebody senior or somebody who is calmer, because somebody who comes with a fresh mind or is not that agitated will be definitely able to handle the situation in a more effective manner. So till this stage, you still have a scope to control the situation, because if they are being defensive, if they are being aggressive, and but you are being assertive and you are trying to be helpful and you are trying to create a situation where their problem can be addressed, you will be able to mitigate a situation. But when the things move on to crisis stage 3, that is acting out. That means the person has actually lost control on their behavior or on their emotions, so they can act out. They may start throwing things, they may damage furniture and other items, they may even start hitting people. And they are usually not capable of reasoning at this point because their emotionality has overtaken or hijacked the rationality. So that is one stage when they actually become aggressive. So at this stage, I think our response should be safety. Because when they are not able to understand what they are doing, but they're just acting out, that means they have lost all rationality. So make sure in this stage you and your people around you are safe. It could be other patients, it could be your other staff, it could be anybody around you. So make sure that you and those who are around you are safe. Also, activate your emergency procedure, whatever protocol you follow in your hospital or in your facility. Uh, you will have to follow that procedure and also request assistance um, as per the protocol. So at this stage, you can't uh, control the situation, but you can just save yourself. So at this stage, if I may ask you, can we control the patient by holding the patient tight?
No. No.
No. Because that also will be considered as a attack on the patient. But I am not sure, should we really continue with this or there should be a way to handle this also? We can't allow one person going around and taking everything and not stopping them. Crisis stage 4. So once the patient has already acted out, then their emotions are calmed down, they'll gain rationality. So they may regret their action or they may not regret for that matter. A lot of time they realize that they have overdone or they have overreacted. Also, they may be scared of now the legal action that can happen on them. Unfortunately, we do not take it to law. But I think it's time that we even start taking action on the patient party. Usually, they want to just apologize or compromise, maybe out of fear for what they have done and what action can happen to them. So, what do you suggest? Should we allow this, or should we take legal action?
No.
Sorry,
No, ma'am.
we should not allow, or we should allow.
Madam, there have systems in place to address this kind of thing, which are
Hmm.
validated systems.
Sorry, I didn't get it. Could you repeat?
There have to be systems in place which should be set in such a way that they are validated and they are the recommended ways to, means it cannot be an individualized response. It has to be a recommended response to situations which escalate. And for that, the hospital or the medical personnel should not be held liable for their response.
But how many times have the hospitals really taken it seriously and have lodged FIR against the patient party? That's what is my concern. See, we don't want to, get into all that and we say, okay, if they're apologizing, let it be. But then that's actually setting precedence that nothing will happen. We can do whatever we want and we get away easily. Unless you set precedence that if they are either damaging the hospital property or they are physically, harming anybody, there will be a legal action. But I see very few hospitals taking action on the patient. That's what I was asking, that are we doing, actually taking some action, but actually no. Okay. So usually what we say when they have come to, make amends. So it's an opportunity for the positive change. So let's reconnect and resolve the issue. But I am not very sure how many of them actually apologize genuinely. So, but if you are okay, then communicate with the person as they calm down and then resolve the issue. A lot of time, there is an error on our side also. The problem is that's the reason why we are not very okay with the idea of lodging a FIR or taking a legal action. But then we have to have some system where these situations should be minimized. Okay, now coming to stage 4, after this whole thing is done and you have kind of compromised or you have apologized each other, it's important to document whatever has happened. So the incident reporting format, there has to be a format where I'm sure most of the hospitals have it. So the report should be, made of what exactly happened, uh, how they behaved, what exactly happened, what was the background situation, how you responded, or what steps you took to mitigate the situation, what was the outcome. Ultimately, then what both parties agreed to. Any suggestions from this episode that you want to give to the management or to your team or CAPA so that these things don't happen again or can be minimized? And then, of course, how you can be reached for questions. You write your name and your contact details. The idea is because this will help us, first of all, as a way to learn to minimize such situation. And also, there can be a legal, this document will come handy as a document of evidence of what exactly happened. So after the situation is over, I think we should make it a practice to reflect on this situation. So important to check in how we felt in this situation, how are we feeling right now. Discussing with colleagues, asking them, learning from them how they handle, how they prevent, what all do they do, is a good way to upskill. Reading material, a lot of material is available on Google. Learning how to handle conflicts, learning how to negotiate, learning how to manage anger and handle aggressive people. There are so many programs and on crisis management or handling difficult situations. So the carry home message that I want to give you at the end of this is there's always a storm before it rains. So we should be able to identify these warning signs and intervene before actually a crisis happens. And learning how to do triaging, identifying people, situations, conditions where there's more likelihood of patient party becoming aggressive is helpful. Thank you. So what questions you have about whatever discussion we have had this morning?
Ma'am, what is the elaboration of CAPA mean?
That is
CAPA.
corrective action and preventive action. CAPA is corrective action and preventive action. That means if something has happened, that means we can take some preventive action to prevent it from happening in future. But at the same time, we need to do some corrective action to minimize the damage and also address the patient's concern. That is corrective action that we take for this case, and then we take preventive action to prevent such kind of episodes from happening in future. Thank you. So what are the questions or comments or points that you want to add?
I think actually in MBBS and also in the nursing curriculum, it should be adopted. I think it will be better if we learn from our student.
Absolutely. I think it should be part of their training. Okay. Any question, any feedback, any comment?
Ma'am, in the conflict management style, I'm talking with respect to my result that has come.
Mhm.
The first one says it's collaborative owl. The
Mhm.
second one is avoidant turtle. So they both themselves are very conflicting in nature. Means one is in a win-win situation, the other one is in a lose-win situation.
So
Why
there
is
are,
such thing?
yeah. So that means your primary way of handling conflict is that you try to create a win-win situation.
Okay.
But then there are situations when the other party is in not that mindset. For example, you are collaborative, but the other person is competitive.
Acha, okay.
It
Then in that
only
case, I would like to shy away. Yes. Okay.
yeah. So it will only complement if your style matches with the other person's style.
Okay.
So if you are collaborative with the other party is collaborative, you will create win-win situation for self and for the other person also. But if the other person is, for example, competitive, so there, how much ever you will try to collaborate, the other party will not let your collaborative style work.
Understood. Okay. Okay. Based on the situation, maybe these are the various conflict management style that I adopt.
So your first approach is collaborative.
Okay. Okay. Ma'am.
Primary
Understood.
approach is collaborative. Yeah.
Okay. Ma'am.
Anu, any questions?
Ma'am, I've been wondering actually, we have been talking about this whole sessions of this communication training and class. The basic trait, the basic character of a person. So, how that thing can be changed. So, that is the most important thing when you are dealing with a situation. No? So, what is your take in that?
Dr. Bijoy, working on others is not really very fruitful, but we can work on ourselves. And if you want to change people, especially with whom you have to work on daily basis, it could be your family, it could be uh, your team members with whom, because these are the two categories of people with whom we spend most of our time, either at home with our family or with our uh, team members. So one of the best ways is to learn, first of all, to be a good role model, and then learn how do you influence them. So you will not be able to directly make any changes in their behavior because nobody wants to change at others' instructions. So if you remember, we discussed about Stephen Covey's book called Seven Habits of Effective People. So in that, I said that we have three circles. Earlier, actually, he has proposed two circles: circle of concern and circle of control, which was easier. So let me first tell you that. So please remember three things we don't have any control on: people, situations, and past. You don't have any direct control. So even if your concerns are 100% true, they will go in the circle of concern because we don't have any direct control on that. What we have control on is our own behavior, our own thoughts, our own feelings. So we have to work on ourselves to, one, of course, even working on self will empower you with the right skills to handle even difficult situations. Also, we try to change the other person, we try to influence the other person. But once you have tried hundreds times and you see it's not bearing any result, you will have to let go. I think I told you in one of the classes that I have two words for that. You remember that? Anybody remembers? So when I try to change or help or influence the other person, and when I see it's not happening, I've tried so many times, but it is not happening. So I have two words saved for myself.
Something in Hindi?
Yes. Hari Ichha. So, I mean, when I say this, I feel very calm. I said, okay, I've tried my best, but this is God's will. I can't interfere with that. So, a lot of times you'll come across people whom you can't change. If their core nature is very different and it is not compatible with you, see, we learn to distance ourselves from them. Sometimes physically, sometimes emotionally, and sometimes psychologically. Especially with our family members, you can't distance physically, but you can definitely distance psychologically and emotionally. Yes, Dr. Purni.
Ma'am, just for general interest on the same theme, which is so good, I would like to share that on this subject, there is a podcast by Mel Robbins, which is called Let Them. The idea which made her podcast very famous, it is available on all media. You please can go through it. It is called Let Them by Mel Robbins. Thank you, ma'am.
Thank you. Thank you. I'm noting down.
Let them be who they want to be. Let us be whom we are.
Mel Robbins. Thank you. Thank you. Thank you, Dr. Vijay. I think that was an interesting question that you asked. Doctor, so many questions from your side. Today you are very quiet.
No, I'm sorry, I'm totally exhausted today with too much of workload. Yeah, ongoing NABH evaluation systems. Lots of preparation.
Must be very, very busy.
Yeah.
Thank you. No problem. It's perfectly all right. All the while you have been very actively participating and contributing. So that's perfectly all right. Jenna is.
No, I think it's interesting to get to view different viewpoints, and I'm enjoying the inputs from Purnima ma'am, different podcasts and different stuff to read and listen. So I'm just noting down so that I'll utilize the opportunities as it comes.
That's the beauty, you have so many other people in the group. We learn from each other. It's rich learning for all of us.
Recently,
ma'am, I have a question.
Just 1 second, Dr. Azad. Yes, Dr. Sohn, you were saying something.
No, I was recently, I think this is in connection with Dr. Vijay, changing others and changing ourselves. I recently learned a book called, I have heard about it. I've started listening to the audio podcast. It's Positive Quotient by Shirsad. So that's an interesting book. I think it talks about positive quotient and why 20% of people can achieve what they want. So it talks about how we can change ourselves, how we can, even if I think what are all the things that sabotages our growth, our well-being, how our mentality sabotages ourselves, and how we can overcome them, and so that we can attain a peak performance state or a mentality. It's not just the entering a rat race, but then to perform in an optimal state so that we don't stress ourselves. At the same time, we are at a good performing levels. I found that book very interesting by Shirsad. It's a positive quotient that was very interesting to listen to as well. One of my friends has subscribed to that app. I think there's an app. So one of my friends has subscribed to an app. So they give a lots of tips and practical applications. It's about rewiring our brain by certain practices so that our neurobiology works for ourselves. So I found it interesting. So that's one of the ways to help to change ourselves. There are lots of stuff, and that's one of them. I find that interesting. Yeah. Thank you. I thought I'll share this.
Yeah, please share in the WhatsApp group so that everybody can. Yeah. Thank you. Thank you. Yes, Dr. Azad, you were asking something. Please go ahead.
Yes, ma'am. sometimes we're facing some problem whenever we have to refer a patient to a higher facilities, like as whenever patient in my hospital there is no dialysis facilities. So whenever any patients actually have acute kidney failure, we have to refer them to another center, and then the patient actually becomes angry and tell us if you doesn't have all the facilities, why you have actually treat my patient before. This is very much embarrassing situation, and we have actually feel lot of problem whenever we have to refer the patient to any other hospital or higher center.
So I think honesty, transparency, answering their questions with clarity is the way to, keep them informed and not keeping them in any kind of doubt. And also, in case if you think the patient will require dialysis, I mean, in cases that's what it. So also telling them that this is one of the treatment you will require, but if you wish to stay with us till you really need it, we are ready to look after you. But otherwise, if they want to go, again, patients' welfare should be primary to us, and that should be visible in our conduct. Keeping them in dark, not sharing complete information is definitely going to agitate them. And in the end, they will blame us for the same. Thank you. So I think only Dr. Razak is going to present today. I'm extremely sorry. I don't know what has happened. So we are left with just 2 more sessions. I don't know how many of you are still left to do your presentation. Otherwise, you will have to record your presentation and then share in the group.
Sorry, ma'am.
Dr. Razak, you will be presenting. I'm going to allow you to share your screen. But it was for all others who have not yet completed their presentation, because we have only 2 more sessions. Normally, I don't like to keep any session in the last one, any presentation in the last session, because there are other things to be done. But I mean, even if we try to accommodate, we will not be able to accommodate more than 2 people in the last one. So you will have to see if you are not able to do your presentation, you will have to record and share in the group. So Dr. Azak, I'm going to allow you to share your screen, and please start with your presentation. Yeah, you can present now. So 4 people are wanting to present in the next class. Yeah, I can see 4 names.
Uh, uh,
Dr. Razak, we are not able to hear
Am
you.
I actually audible and everything is okay?
Yes, we can see your screen.
All of you?
Yes.
Yes.
Yes. Yes. Welcome to you all to today's presentation using videos to facilitation. Actually, before my presentation, I want to show a video to all. Please just carefully have a look to the video and what's the problem? Right?
Dr. Razak, if there is no link, the video will not start. Where is the video?
Actually, uh, there is the video. Just I have checked it before, just before the class, but now I can't open it. How? What's the problem?
Because I don't see any link on the slide.
Uh, Ma'am, 1 minute.
Sure. Dr. Razak, is it okay? I think we can go to the slides. It's all right if you're not able to show video. Dr. Razak, am I audible?
শেয়ার স্ক্রিন করতে হবে। শেয়ার স্ক্রিন কোথায়? কোথায় দেখো না আমাকে? শেয়ার স্ক্রিন। ওই শেয়ার স্ক্রিন কোথায়?
Please unmute your device.
Ma'am,
Yes, Dr. Izzat.
am I audible to you?
There's a lot of network issue, I think, at your end. So
Yes, ma'am. My
voice is not clear.
is video is audible to you all?
Yeah, please switch it on. No, there's no audio. Is there video and audio? Is there an audio in the video?
Yes.
No, we are not able to. But we can see the video.
Then, ma'am, actually, I am able to share my audio. Just have a look the video. I think it will be actually explainable to you all. Uh, Actually, this is a video. I am sorry. I am not enough expert to in my IT. Then I am very much sorry. I am unable to hear actually the audio. This is the video of the positive attitude. All of you have seen a rat actually trap. This rat is actually in a trap, and after some time, the rat realize and gather energy to have energy to regain the situation and make that trap a toys and using like a dumbbell for exercise and make a view. Uh, our total life is actually full of some kinds of sufferings. And if you have positive attitude, then we can make all the sufferings in a positive way. Whenever I take class actually in for positive attitude, all of the time, I actually like to share this video. I'm again sorry, I'm not unable to hear all the audio. Actually, there is a fine music about the rat. Any comments? Actually, if you can, main theme of the video. Please.
I think we could understand the message in the video.
Ma'am, actually, the message is we have the sufferings, but if we have positive attitude, then we can make our own way and try to make our sufferings enjoyable and have a better look for the future.
Yeah, we got the
And
message.
in this video, the rat was in the trap. Yes. Yeah. And then video as a tool for the facilitation, video pedagogy, especially refer to the use of video content, then teaching tool, and video pedagogy can include the pre-recorded lecture, structural video demonstration, simulation, multimedia presentation, and it can be used in combination with other teaching methods to create a more dynamic and interactive learning in a classroom instruction, online learning platform, professional development, student project, and parents communication also. And advantage of using this type of video pedagogy is visual learning, more engagement with the students or the learner, accessibility and flexibility, and collaboration to you all. And these advantages, yes, like today's my presentation, technical issue is the main problem, and passive learning, and sometimes it is time consuming, and sometimes this may cause a distraction. distraction, and sometimes there's a lack of interactivity. Use of the video pedagogy, actually, we have to do the video concise and focus on mainly our key objective, and use of variety of visual aids like as graphics, presentation, animation, uh, to provide a clear instruction and guidance on how the student should interact with the video content. And do incorporate interactive elements.
Dr. Razak, we lost your audio connection. Dr. Razak, would you like to log out and log in once again? Sorry, I think that's a very real problem with technical glitches like this. We're all learning to handle these things. So in the next session, I would request 3 of you can present so that we are just left with one more presentation for the last one. And next session will be on 10. I think Dr. Razak is not able to even log in because he's should I call and check with him? Yeah, okay. Okay, please join me. He's joined back. It's showing that he's joining, but he is not able to join. I think there's some network issue.
Presentationটা কোথায় যাবে আবার? Share screen. Present hand video. So again, am I audible to you?
Yes, you're audible.
Again, sorry, ma'am. Actually, I have lost my connection due to current. Actually, my line was switched off, and I have also conclude my session. Count of the video pedagogy I have already talk to you. Don't rely solely on the video. Don't overload the video. Don't use video as a substitute. And don't neglect to access the student comprehension and learning outcome related to video content. And don't overlook the importance of the video quality. This is all about my presentation. If you have any question and if I am able to answer the question. Actually, again, ma'am, I am very much sorry about poor. Actually, I have poor knowledge about the IT and also I have some technical problem.
It's perfectly all right. I think you have done a good presentation. Once you will share it in the group, they will be able to read the points and understand it. But most of it you have covered. But I think it was a good example of what all can happen when you are using video. So
Yes, yes.
yeah, network can be an issue, IT can be an issue, video, I mean, audio, video, both can be an issue. That's all. We are okay with that. I request you to stop sharing your screen.
Okay, ma'am. Okay, ma'am.
Yeah. So Dr. Razak?
Yes, ma'am.
Okay. Any questions for Dr. Razak? I think video is a very powerful tool as a training pedagogy, and it really helps explain a lot of complex and abstract concepts when you are able to see through video. And we see it being used in so many spheres of life, where we have animated videos and where we have real life situation videos, and we learn from them. And it should be used in the, and it also creates interest and curiosity and engagement with the audience. So I'm sure videos you must be already using in your program. Okay. So any questions for Dr. Razak if somebody wants to ask or clarify something? Okay, if no questions, we'll close the session here and let's meet on 10th, that is next Wednesday. I'm sharing the feedback form. Request you to give your feedback, which most of you are not giving. So I'm clueless about your feedback or your thoughts about the program. But I'll share the feedback form in the program. Thank you so much. Good night.
Good night, ma'am.
Good night. Bye-bye.
Right.